Good morning and welcome to all of our attendees for this International Association of Emergency Managers webinar. Today's webinar is hosted by our Disaster Cost Recovery and Finance Caucus, which is one of many subject-specific caucuses, committees, and ad hocs within IAEM. I am the second vice president for IAEM-USA, and it's my pleasure to introduce you in just a moment to our caucus chair, Mike Martinet. First of all, just a little bit of administrative information. All of the audience is on mute, and we are going to be submitting questions through the chat feature of the webinar software. You should be able to see that chat box at the bottom right column, or if you've moved it to the left of your control panel there, be able to type in whatever message you have. Recognize that we will be dealing with the questions a little bit later in the presentation after introductions of all of the different panelists. Mike Martinet, who is the chair of the Disaster Cost Recovery and Finance Caucus, it's my pleasure to introduce him now. We've been close friends and worked on many, many projects over more than the last 20 years, almost 25 now. He was the one that initiated the creation of this caucus, and lo and behold, during times like this is important as ever. So it's my pleasure now to hand the mic over to Mike Martinet. Thank you, Mike.
Thank you, Carolyn. Thank you, Beth Armstrong, IAEM, Chelsea. Thank you to our panelists, not in any particular order, Ernest Abbott, John Shaw, and Margaret Larson. And I will introduce each of them right now very briefly. And they're going to talk about 2 or 3 or 4 most important points to them in their work in public assistance. So I'll start with Ernie Abbott. If I read Ernie's bio, we'd be here all day, so I'm not going to do that, but I'll tell you very briefly. Ernie was the chief counsel at FEMA in the Clinton White House, obviously a couple of years ago. And since then, Ernie has been working on behalf of cities, counties, and other public agencies, dueling with FEMA on issues of cost recovery. So Ernie, if you want to talk about, 2 or 3 of the most important things, or perhaps the most oddball question that you're getting from people that you're talking to out there. Ernie?
I'm not sure I'll start with the oddball question. The thing which we've been trying to stress is this is it's an unprecedented national emergency declaration, which is then administered, you might say, by FEMA normally through individual declarations by state. For emergency. The key is to what has been turned on by those emergency declarations. And it is, quote, eligible emergency protective measures taken to respond to the COVID-19 emergency at the direction or guidance of public health officials. So when the emergency management community is looking at that, you're familiar with what FEMA does for eligible emergency protective measures. That's something you can find in the Public Assistance Program and Policy Guide. And in addition to that, you have to make sure that for the COVID-19 funding for FEMA, it is taken at the direction or guidance of public health officials. And so that's one of the key things that you need to be watching. The second thing, and then I'll go on, is FEMA, in a really unusual act, put out a guidance saying, we agree that this is a exigent circumstance that the nation is facing now, and therefore eligible work that you do by contract, you can state that the exigency or emergency does not permit a competitive procurement. And so you are able to do non-competitive procurements at this time. But don't forget that there are a bunch of other procurement regulations that have not been waived. You cannot have a cost plus percentage of cost contract. You have to provide or put together a cost analysis to show that the cost of the work that you're doing is a reasonable cost. You have to make sure that you've got the federal terms and conditions that are attached to it. So those are things you shouldn't forget, that just because it's an exigent circumstance and you don't have to have a competitive procurement, that there are no applicable regulations. And I guess the last thing, I think you have already put out as a handout FEMA's COVID-19 eligible emergency protective measures guidance. There is certainly going to be additional guidance that comes out of FEMA providing a little bit more detail. So you got to be watching for that as well. With that, I'll turn it back over to Mike.
Thank you very much, Ernie. And by the way, ladies and gentlemen, the Baker Donelson, B-A-K-E-R, second word Donelson, D-O-N-E-L-S-O-N, law firm has a really good website on COVID-19. And some of the materials you got or have available in the handout, I first came across on the Baker Donelson website. So thank you and hats off to Ernie and his crew for trying to keep up with the latest releases on that. With that, I'd like to introduce Margaret Larson. Margaret Larson currently is a senior vice president with AG Witt. For those of you who don't follow all this stuff, James Lee Witt apparently sold his interest in his firm that was merged with Witt O'Brien's and has now started a new firm. And James Lee was smart enough to get Margaret Larson to join up with his firm. Margaret has years of experience in disaster cost recovery, working with Ernst & Young and also with the Federal Emergency Management Agency. And Margaret, I believe, has also worked in the nonprofit sector. Margaret.
Hi, good morning. And I say morning because I am in California. And thank you, Mike. Thank you to IAEM for organizing this and asking me to be a part of it. Ernie and John are both former colleagues. Ernie and I worked together at FEMA headquarters when he was general counsel. I was in legislative affairs and stayed at FEMA in a variety of capacities before moving to California. And then doing work on the consulting side of disasters. But yes, I did work for Feeding America, the network of food banks, which has a tremendous role right now in what's going on with the response to and recovery, ongoing efforts for COVID-19. And John and I are also former colleagues. So it's a friendly group of colleagues on this phone call. I want to build a little bit on what Ernie has indicated as some of the things that we are hearing to add to what he was saying about the procurement and emergency and exigency period. FEMA has, as he said, relaxed the rules and regulations, but pay very close attention to how you're documenting procuring any kind of support during this time frame, because at some point that is going to have to be included in what you document and put into the FEMA grants portal so that your decisions are not questioned. And then to the point that I just mentioned on the grants portal, we haven't yet, for clients that I'm working for, been putting things yet into the portal. However, it's going to be, I think, quite a bit of a free for all, and this is my opinion, but it's going to be hard to get accounts set up for all the different declared events and subrecipients, not to mention the recipients and therefore subrecipients to receive their login and so forth. So I think it's going to be a sense of urgency as everybody's completing requests for public assistance, and then to get into the system so you can start building your claims and developing your project worksheets. And so with that, I would say, there's a lot of angst and uncertainty about how this is going to happen, and just it's going to take some time to work through that process. So I think everyone's going to be going through that. The other thing is on the FEMA, the simplified process for public assistance. More guidance is going to, I'm sure, come out on that, but just know the same thing as with the emergency and exigency period contracting. I would make sure that you document things, and that's a key point. I'm sure John will reiterate as well, the importance of documenting everything on what you're doing right now is going to be essential to the reimbursements for Cat B. So with that, I'm going to turn it over to John, and thank you again for having me.
And I'm going to just step in for 1 second to introduce John Shaw. And thank you, Margaret, for those comments, and we'll come back. John Shaw is currently with Ernst & Young, doing public assistance consulting work, cost recovery. Prior to working with Ernst & Young, John was with, oh, I'm going to kill this one, Alachua County in Florida and Jacksonville, Florida. So he's got about 10 years in emergency management and obviously focused experience on disaster cost recovery. John, you're on.
Good day, everyone. Mike, thanks for the introduction. It is hard to say. It's Alachua County, and Margaret, you had me right. I didn't mention documentation, so thank you. So for everyone on the call, I really appreciate you joining. Here at EY, some of the things that we see a lot is the need to integrate your finance and admin operations into your EOC, and if you haven't done so, to make sure you do that immediately. Really, this way you can track your procurement compliance in exigent circumstances, as Margaret and Ernie have both mentioned, your resource tracking, timekeeping, and really, your finance admin component is always going to have the longest time of any function within your EOC for how long they will have to deal with this. And it's really important that they are there with you during all the decisions that are made. Additionally, finance admin is really, really important to cost tracking, as Margaret had alluded to. It is really a big piece of the integration of finance admin into EOC operations. You want to make sure you set up cost codes to track your costs. Examples include a number of the items seen there on the in the PDF, but we're talking about emergency operations center activities, call center activities, specialized medical equipment, non-congregate sheltering, and remote working and disruption to workplace costs. And it's difficult to track these costs at times because you're doing this amid potential workplace absenteeism and social distancing, in addition to a normal incident, and how we have all found that can be difficult to try to wrangle everything that's going on to make sure that we keep track and control these costs. And then finally, it's really important that you have, if you haven't started yet, that you develop and implement a recovery funding strategy. We're not just talking about your FEMA Category B costs or your emergency protective measures, but we're also looking at your insurance policies. Does your insurance policy or policies cover this event? It can also be difficult to really forecast what your jurisdiction's financial capacity is going to be in the next several years amidst COVID-19, but how are you going to cover these costs when you have likely reduced tax revenues from, at a minimum, sales tax impacts? We're looking at the FEMA reimbursement timeline, which isn't immediate, as anyone on this call in the panel can certainly tell you. You're not going to get these costs immediately. It's not going to be next week. Hopefully you'll get it sooner rather than later, but this is a nationwide impact. So amidst that reimbursement timeline, how are you going to cover these costs? What is the capacity of your rainy day fund, and have you looked at using that? And then finally, overall, what is your plan? How are you going to keep your government sustainable from a financial capacity amidst COVID-19?
Thank you, John. I would like to just briefly go over the handouts that are available to you. Toward the bottom of your screen there, there's a little tab for handouts 1, and you can look for the IAEM DCRC webinar. First of all is the notice of the declaration from the president. Secondly is the coronavirus eligible emergency protective measures. This is one of the first documents that came out from FEMA. Following that is the public assistance non-congregate sheltering delegation of authority. And this is a significant change. And I'll ask, when I'm done, our panelists to comment on this as well, if necessary. Congregate shelters are the shelters you see in gymnasiums and high school auditoriums where you've got 100, 200, 300 people, in cots. We can't do that with COVID-19. However, in normal disasters, the authority to move people from a congregate shelter, a mass shelter, into what FEMA terms transitional housing, either an apartment or a hotel room or something like this where they've got their individual space. Prior to this, only FEMA could do that. Now they have released that authority. I would say tread carefully on this, make sure your ducks are lined up if this is something your agency is going to look at, and read that carefully. So, but that's a huge change for us on non-congregate sheltering. Then there's the pandemic simplified public assistance application. Simplified is a stretchable word. And Ernie talked about, or John talked about the fact the money's not going to flow fast. Imagine the federal fire hose and we're trying to hook it up to a plastic straw. Okay, the water is going to come dribbling out. They can't possibly respond fast enough to fill everybody's claims in a couple of weeks. So it's going to be a slow process. Following that, number 5 is the procurement under grants conducted under emergency and exigent circumstances. Ernie talked about that. We can take questions if necessary. Number 6 is the excerpt from the Public Assistance Program and Policy Guide. I would highly recommend, if you're not familiar with this process, download this document. It's a couple hundred pages. It's easily readable, and it will give you a lot of guidance. This particular section starts with medical care and goes through several other areas that may be eligible. Number 7 is the Coronavirus Public Assistance Simplified Application. Oh, looks like I've got that in here twice. Maybe not. Public Assistance Simplified Acquisition. Number 8, talking points. The PA, Public Assistance Application Simplification. So this is just a FEMA talking paper. And then the last document there is the Public Assistance Applicant Procurement Compliance Checklist. When you're procuring things, I would recommend that you look at this very carefully. And earlier, somebody used the term recipients and subrecipients. For those of you that this is a new adventure, a recipient is either a state or a tribal nation. A subrecipient is any political division of that state, or it also can be a tribal nation if they choose to go through their state. So tribal nations have an option to go direct as a recipient or indirect as a subrecipient, and all the other units of local government within a state are subrecipients in federal public assistance parlance. With that, I want to go back and then open it up to the panel. And one of the questions that I've got here, and I'll throw this out to everybody, Will the purchase of an incident management system such as WebEOC or VOCI be an allowable expense? Are there limits on amounts? And what is allowable for reimbursement? And that came, I believe, from Mark Dembski. Ernie, first.
I'm trying to scroll up in this document. Yes, I think there is a good chance that a purchase of something which is required to manage your system could be eligible for reimbursement. There we go. No, it says emergency operations center costs, training specific to the declared event, technical assistance. It's not the most obvious thing. If you don't have any kind of control system already, then I can see it being a necessary cost. I had wanted to say something about the philosophy of FEMA over the years with respect to funding medical care type costs in an emergency. Because when you go looking through this list of eligible tasks that are in the fact sheet that they've already put out, you'll see that it has a lot of qualifications on what part of the medical care costs are going to be eligible. And so I think it's helpful to try and understand where FEMA was coming from, to think that their kind of view about medical care facilities and hospitals and nursing homes is that they are in the business of providing medical care, and they normally get paid for the work that they perform as medical care providers by the patients, by the insurance that the patients may have, by Medicare or Medicaid. And so it's not obvious, perhaps, that just because you suddenly are providing a lot more medical care, that means that there should be more, FEMA should be providing funding for this real big increase in the demand for your general business. And that's why when you look at what's eligible, they are talking about in emergency medical care, they're talking about non-deferrable medical treatment of infected persons, a related medical facility. They're talking about, well, if you have to build temporary medical facilities because the ones that you have been doing business in aren't adequate, they can fund the temporary medical facilities, enhanced medical capacity, and so forth. As you move towards things that seem to be more permanent, and that's my only hesitation about a WebEOC type program, is whether somebody might think it's temporary or permanent. But the more permanent it is, the more I think FEMA is going to be looking askance about why are you spending money for permanent things when we're in the midst of this extraordinary, hopefully short-term medical emergency. But I don't know, it may be that some of my fellow panelists, Margaret or John, would have a better sense of how FEMA would react to a WebEOC type program.
Margaret?
Yeah, Ernie, sure. My thought is that they may hesitate. My initial reaction is that they're going to hesitate to pay for a system purchase. But as we're talking, I'm thinking, and there's so many unknowns and things that might be a little bit different because it's pandemic and the type of event that we're looking at. I think it will be helpful to work directly with IAEM to come up with questionable expenses and have them help work through answers on behalf of the group with FEMA directly. And so whether it's, working with Thad Hughley or others, in addition to Beth and the team on the phone, maybe that, I'm just thinking there's going to be a need to come up with questionable cost and reimbursement expenses that are going to require a group discussion to help facilitate a favorable answer. But I do have a little bit of concerns about WebEOC or another system being purchased at this time, unless we have that discussion. John, do you want to jump in?
Yes, thanks, Margaret. I concur with Margaret on that. My concern is that the permanent system, as Ernie had mentioned, it doesn't make it too comfortable if really you're purchasing something that could potentially supplant other operations or supplement other operations, whereas this is for the pandemic. And so if you're looking at the equipment and services you procure, are they being done as emergency protective measures for this incident? The system of WebEOC, and I believe Mark and I have met before when I was a county director, but the system of WebEOC is certainly very useful. But in terms of procuring that specifically for a pandemic incident, I am not sure that would be fully reimbursable by FEMA. And I do think that Margaret's recommendation to have IAEM help to kind of corral these type of questions that can be very costly for a recipient or subrecipient is a fantastic idea.
And let me just add, because I would hesitate on acquiring a system. First of all, if you ordered the system today, is it arriving tomorrow or is it arriving in 6 weeks or 2 months? In which case FEMA may say, nope, you didn't use it on this pandemic, it's not eligible. And then the other thing is it's a permanent system. You use it for several weeks, a couple of months, and then it's shut down, and FEMA says, well, you only used it 2 months, we're only going to give you a pro rata share, probably something like pennies on the dollar for what you spent. So I think we've beat that. Let me see if we can get to a couple other questions here. Okay, now we've heard some cities are tracking salaries for officers that are paid to stay home simply for the purpose of social distancing for possible reimbursement. Is that something that would count? We were under the impression it would not, since we would have been paying them anyways. The question in regards to work from home is in regards to work from home equipment. We purchased a number of laptops. So we got 2 questions. So let's talk the first one here. Real quickly, Ernie, you want to throw in on this question of what about employees that are paid to stay home only for the purpose of social distancing?
That's a very interesting question. Those of you who've been dealing with FEMA and what's an eligible emergency work for a long time know that FEMA has never wanted to pay for people doing standby work. They say you only eligible, the only thing which is eligible is people doing eligible emergency work. And just staying home does not strike me as eligible emergency work. It's almost more akin to one of the things that FEMA doesn't pay for. They don't pay for pre-positioning costs of getting power restoration crews in place and then discovering that you don't need to use them. They don't pay for bringing in a second shift of nurses prior to a hurricane so that there would be somebody able to take a second shift when the first shift has to stop working because they've been on duty for 12 hours, because that's not eligible emergency work. It's important costs to incur. So until FEMA comes out with new guidance, I would say that paying people to stay home is, that's important social distancing, but I think that it's not FEMA eligible.
Ernie, can I jump in with one caveat that I think might apply to the question?
Okay.
I'm curious if if we're also looking at time tracking for, in this case, if someone's doing virtual emergency operations center or call center work, and if it is along those lines, they're getting paid to do their, their emergency management job just in a different location. I'm not sure if this question was getting into that line of work or just that line or angle. But I just want to throw that out there. If it is an eligible activity, they just happen to be doing it from home, that those activities should be tracked as well, like John mentioned when he kicked it off. So
I completely agree with that, Margaret.
Yeah. That was it for me.
Okay, thanks, Margaret. And yeah, a lot of these things are going to be determined on a case-by-case basis. Sometimes there is no accounting for the regional differences. We've got 10 FEMA regions in this country, and different regions look at things differently, and different FEMA employees look at things differently. So if it's flying in region 4, it might get shot down in region 9 and vice versa. So that's always part of the equation. I got a very interesting question sent to me in email last night from a lady on the West Coast talking about signatures, which kind of ties into this. So they've got people that are working virtually, and maybe they're taking COVID-19. They're on the COVID-19 hotline panel for this agency, and they're taking calls from the community all day, but they're working from home. So how do they sign their time card if they're at home? John, you got any questions on the legality of signatures when people are working remote?
Like on the legal side, I can't offer any advice on that. But my first thought with signatures is, what does your HR policy allow to maybe allow those employees can they send an email that will then act as their signature that they sign their time card, or are they able to download a PDF signature app to, I'm sorry, not an app, but a program to their computer to be able to digitally sign their time cards? Are there any options that are available for those employees to be able to do this outside of the normal signature process? What can they do from home to allow it to be digital?
And those were my thoughts. I've been signing, I sold a house, I bought a house, I signed contracts digitally. I can't remember the name of the program, but there's probably multiple ones out there where you can digitally sign. And Ernie, if you just opine on this, should the agency have a formal policy adopted by their elected officials that authorizes electronic signatures?
I was sort of thinking the validity of electronic signatures has been growing each year. It's not something I've researched, frankly, probably for a decade. Certainly, there's a lot of programs. Adobe Acrobat has some applied digital signatures aspects to it. I would, and generally speaking, I haven't run into a problem with sending PDFs of documents that have signatures at the bottom and having that, even if it's sent by email, being valid. My guess is that although it's an issue of state or local law, and there may be some jurisdictions that really don't permit it, you ought to be able to submit time information electronically. If the agency doesn't have a time card in that kind of a format, they ought to be able to come up with a procedure by which employees who are being asked to telework can submit their time information and have it processed without dealing with issues of signature. I don't know if that's enough of a response, but I don't think you're going to get barred from using digital signatures in this environment.
And Mike, maybe Witt's a good way to go about it if there isn't a current existing HR policy per department, or coming from, if you're a city within a county, if there isn't a county policy, kind of rolling it up. If you don't have that, given this circumstance, I think it would be good to document that the questions were asked and that a decision was made by leadership and how they want to document that formally. And I keep using the word document, but just come up with something that says, we've made the decision absent a policy to do the following, and this is the direction and guidance we're giving our employees who need to sign timesheets remotely, and come up with something. And that way they have it. And again, with the multiple ways of FEMA interpretation as you get into various regions and so forth. And I'm going to say it again, you can tell I worked in congressional affairs, but I really do think that this is another example that if FEMA gives conflicting or differing, if not conflicting, differing advice, that this is another area that IAEM can help corral issues and come up with getting solutions and answers through FEMA collectively for their membership.
Thanks, Margaret. And I'm just looking at these questions here as the panelists are talking. Many agencies' employees are working from their homes. Agencies have had to retool, set their IT systems for remote working capacities, accommodate the new working environment. And this is about the costs associated with setting up IT systems, obtaining software subscriptions, and enhancing online efforts to update their web pages. Are these eligible costs? These are probably pretty specific, almost case-by-case instances. It depends on what your policies were existing prior to the disaster onset, how well you document things, and how permanent these changes are, as Ernie talked about earlier. Okay, I'm going to, we got so many questions, I can't get to them all. Okay, let's see here. This question is from Vince, I think it's Slominski. Is the emergency declaration still limited to $5 million per state? John? Am I putting you on the spot?
A little bit. I actually don't have that answer for you, Vince. Unfortunately, I apologize.
That's all right.
I can jump in, and I'm sure that Ernie can expand upon this because it gets into Stafford Act and emergency versus major declarations.
Yep.
But the emergency declaration has a $5 million initial limit. Congressional approval is required for additional funds. It moves pretty quickly when it's a big event. Think way back when, Oklahoma City and 9/11 initially, before the majors declarations were declared and requested by the governors. So if you do not have a state declaration of a major disaster yet, my guess is a lot of the states are putting together all their details so that they can justify and submit the request to FEMA. So I know a number of states have come out with formal major declarations, not just emergencies. So check in with your state, see where they are. If they're collecting data from you on expenses to help build their case, that may be part of knowing where they are. But FEMA can get additional funding. It just requires it requires notifying Congress they're going to spend more than $5 million. Ernie, you want to jump on that more?
Yeah, I've actually never felt that $5 million per state was ever an actual limit. It was a requirement that you keep track of how much money you're spending on the emergency, and if it's going over $5 million, you're required to notify Congress. It's not even a congressional approval. I will say something about the disaster declarations. There have been, as of 10 o'clock this morning, 25 states which have been approved for a major disaster declaration. But it's really important when you think about those major disaster declarations to realize that the programs which have been turned on under those disaster declarations include nothing beyond the eligible emergency protective measures of Category B that had already been approved in the emergency declarations, with one exception. In 7 states, I think it's New Jersey, Texas, Florida, Louisiana, California, Washington, and New York, the crisis counseling program has also been approved. And so don't think that because the president has signed a major disaster declaration that there's any other programs that have been turned on other than crisis counseling for those 7 states and the emergency protective measures that we started this program discussing.
Okay, thank you, panelists. Question, this is going back to the Web EOC/EOG question. Would a time-bounded expense, like renewing an annual license, be likely to be adjudged favorably? I think, you know, you've got the program already. You've already committed to doing it. FEMA's not likely to jump into something that you said you were already going to do. Anybody disagree with that on the panel?
Not at all.
Okay.
I agree with you, Mike.
All right. Many sanitation districts are experiencing a great influx of wastewater into their systems. Many systems are servicing more lines more frequently than normal maintenance. Would the cost for extra servicing be eligible? I guess the question is, how would you tie that to the coronavirus and quantify it? Panelists, any
That's right.
thoughts?
Could you start out, you know, what is eligible are, according to the declaration, eligible emergency protective measures taken to respond to the COVID-19 emergency at the direction or guidance of public health officials. So if you can get a public health official to direct you to do something with your wastewater treatment system, you know, change the filters or something, then you might have more of a shot.
All right, thanks, Ernie.
Mike, I'm going to make a terrible joke, but given how much toilet paper people are buying, it seems like that one's obvious.
Yeah, you're right. You're quite right. Let's see. The question here is it's about supplemental pay for people compelled to work for essential functions. So let me reframe this a little bit. I had a conversation a couple of days ago with somebody where they told some of their people, go home and stay home, social distancing. If you can work from home, fine. If you can't, that's fine too. You know, we're not doing recreation programs or whatever, just stay home. But for those people who were required to work, police officers, firefighters, police dispatchers, among others, county public health workers, if you're at the county level, they were then paying those people double time to work. So they were getting paid their regular salary because all their colleagues were at home, but because they actually came to work, now they were getting paid double. Ernie, Margaret, John?
My first thought with that is, go ahead, Ernie.
Go on, John.
I was going to say is, you know, for those individuals that are earning double time for being, you know, having to work during this incident, is that in their policy that they would earn double time? And furthermore, is the policy applicable to non-declared incidents as well? And that goes for any time spent and hopefully charged to FEMA for reimbursement, is to make sure that all the time accrued by an individual is within policy and is applicable to a non-declared incident as well.
Okay. Ernie, a tag on that?
I'll just add to that to remind everyone that eligible emergency protective measures for FEMA never makes straight time eligible. So you're only talking about the overtime that is paid to be eligible. And then if, as John mentioned, there's some approved way in which you can double the cost of the regular time because of the hazard pay nature of a pandemic, that may be something that if you have to make that change in order to get the people to show up, you would certainly want to document that you had to make the change, and you can apply to FEMA for reimbursement, but I don't have any ability to confidently say that FEMA will provide the funding.
And Mike, one other thing to think about too, when you're looking at these kind of expenses, if a position, if they're getting paid double time, but also are they providing backfill for another position that someone cannot work? That needs to be tracked. And the other question is, are these positions funded by any other grants? Because that is going to need to be, you cannot get, FEMA will not duplicate benefits. And so you have to make sure that if it's a grant funded position, that you acknowledge that and track that accordingly, because again, you can't duplicate the benefits. So these time tracking questions can get pretty complicated and need to be looked at very carefully.
Okay, thank you. Now, here's a little different one from Hazel Johannes, I believe. Are costs associated with setting up, training, and organizing remote board meetings, council meetings, instructional or public safety webinars eligible? So, we had, in my city here in New Hampshire, we had a online council meeting the last time. They didn't have a person-to-person. So questions on that, or hopefully answers on that. Margaret, first.
Mike, I'm doing some work for a couple of universities, and we are putting together the cost of a couple of things. One is converting to remote learning, and we do not have an answer yet as to what's going to be reimbursable there. But the remote learning aspect and IT systems and establishing something to provide that to students is a questionable expense, and I think it correlates to board meetings, city council meetings, and so forth, that if they didn't have the capacity to do that previously, how to go about it. And a lot of cities and counties, if they're bigger ones in particular, will be set up remotely because you can watch on video all these things, but really converting it to the capacity they need to have now, that is a question that I've posed and don't yet have an answer to. So it falls into that list of things to coordinate answers with with FEMA.
Okay. We have some more questions about backfill, and I think Ernie's talked about that. Question,
Mike, if I may, I was gonna say with what Margaret was saying is that simply because there's not any clear answer on whether or not something is allowable, it doesn't mean you shouldn't track everything about it. So any costs associated with that project and decisions made, you definitely want to document that in the event that it is deemed eligible later on.
a good point, John. And one of the things I've been telling folks is document everyone's time that's working on COVID-19, even if their time is not reimbursable. You've got the fire battalion chief, he's spending half his day on COVID-19, but because he's not treating people, he's not out there in the field, his time might not be reimbursed, but his time can be tracked as part of your local cost share, as well as your volunteers and donations that you may receive. All this stuff, if somebody spent money for it or it costs something, and if you properly document it, you probably can put it onto your local cost share, because all of us are going to have one on this thing, unless they want to go to 100%. But I haven't seen that yet. Let's see. Okay. My question is, overtime for paid crew due to shortage of manpower because virus work restriction from other employment. I don't quite understand that one. What about this? This is a question about computers. Kenneth Hagan, please resubmit your question. It was in 2 parts and I can't follow the 2 parts, and I'll try and get to it if I can. Hospital surge capacity planning, Joy Miller, is placing ambulance companies on retainer and eligible costs. I have reviewed the fiscal guidance sent out so far, and I don't see where this is addressed. So are placing ambulance companies on retainer and eligible cost. Ernie, this is a long ball hit out in the left field. Can you shag it?
Yeah, we're trying to locate the ball. It's really up there in the sky. I talked earlier about that generally FEMA likes to pay for the costs incurred in performing eligible work. And we've seen a lot of situations where if you build big base camps and only a quarter of the base camps are of the capacity is used, FEMA says, well, we'll pay you for the quarter that was used. The rest of it we won't pay for. And so if by retaining an ambulance service, you're paying money for them to be around as opposed to go out and find patients, bring them back, care for them, and so forth, then I could see some questions about eligibility. But that does give, there was one other point I really wanted to make, and that question raises it. Remember that Congress last Friday added $100 billion for a new, they appropriated $100 billion for public entities, Medicare or Medicaid enrolled suppliers and provided, and for-profit and not-for-profit entities provided by HHS that provide diagnoses, testing, or care. And the language in that bill is a lot broader than the language in FEMA's current eligibility guidance for emergency protective measures. It includes potential lost revenues, which is something that is not eligible whatsoever by FEMA. And it includes, I think if it's not eligible for FEMA work to retain ambulances, I would still keep track of all of those costs because it may be eligible for this HHS program, which never existed before it was enacted on Friday. And so there is going to be some lag time in getting that program up and running, but it is still a place in which there's a significant amount of money.
Okay, thanks, Ernie.
And Mike, on the transportation side of it, another thing to start looking at tracking without knowing how it's going to be reimbursed, but are other transportation agencies, locally run buses and so forth, are they being used to transport people from point A to point B? And so what expenses get incurred with that? Because obviously if someone is ill, it's a contaminated asset at that point. So all of that's going to need to be tracked. And I've also heard some really interesting discussions about state transport of prisoners, and because they aren't moving prisoners in some cases like they had been, utilizing those buses and those law enforcement officials to help with transportation of people. So all of this falls in the category of not entirely clear who and how it's going to be paid for, but it's things that communities, that their governments are actually incurring as expenses that should be tracked. There's some really stuff out there.
If I may, sometimes doing public assistance is like working in the dark with no lights, no moonlight, no starlight. And on this one particular, I think it's more like working at night in a heavy fog because we just haven't seen everything that's out there and some of the stuff that may be released in a day or two or next week hasn't even been thought of yet at FEMA in terms of changing policies because of the unique nature of this pandemic. Question is, are ICS 214s going to be required for every employee working COVID-19? And my thought is probably not. If you got somebody who's in an EOC all day and they're doing an EOC sign in and sign out and they have an EOC job log, what's the point of a 214? It's just more paperwork. If you're comfortable that they're capturing all their essential duties that are COVID-19 related on that 214 or on your job log, then you might not need a 214. Any thoughts on that from anybody on the panel?
Doing it remotely, it requires definitely writing something down because you won't have the people convening in the EOC in the same manner. And Mike, the other thing is, I think, as much as it's great to see if you have a time code built into the system. I think John started with discussing about coding into the system so that your time is tracked appropriately. If you don't have that set up now, a 214 and tracking via some way sooner than later, going back even to the actual federal declaration date is better. And because I've worked with clients where FEMA has denied the recreation of 214s, and it is a lot of work for the locals to actually do that. So I'm not giving you a perfectly clear answer, but I do think it's documenting until FEMA gives us where they're going to accept some, where they may accept less documentation than in the past. It needs to be thought of as you're going to be required to produce it at some point.
Yeah,
That's my concern.
Yeah, the question is, do you pay for it now or do you pay for it later? And if you have somebody do it now, it certainly eliminates a potential problem, whether it's a real problem later or not. If you can get them, it doesn't hurt. We've got a couple of more minutes. Chelsea, is that correct? Let me see if, now here's a question. Is a nonprofit hospital also considered a subrecipient under earlier discussed recipient-subrecipient definitions? Anybody on the panel?
Yes.
That's a yes, okay.
Agreed. Yes.
Yes, okay, all right, simple questions. If it's a nonprofit hospital, okay, here was just a suggestion from John Panito out in California. An FAQ would be a vital resource. Is it possible for IAEM to start collecting questions and looking for answers? Well, I guess that's taken off of Margaret's question. Where can I get the specific details on how to fill out properly the ICS 213 and 214? Let me suggest that the ICS 214 is deficient in terms of cost recovery for us who are not firefighters. If you're a firefighter, ICS 214 works fine. If you're not, if you look at an ICS 214, you'll find there's a lot of missing information there. Danette, if you send me an email, I'll send you an ICS 214 modified. Okay, and let's close on this question. What are the top 3 concerns about the non-congregate sheltering FEMA reimbursement? Ernie, you want to go on this one first? Top 3.
What's the question about reimbursement?
Top 3 concerns about the non-congregant sheltering or the transitional sheltering.
I have not personally spent a lot of time on the non-congregate sheltering question, so I'll defer to Margaret or John in case they have.
Okay.
I have to echo what Ernie just said. I haven't either.
Okay. All right. So this is a.
And well, I would just add that for me, thinking of another client that I've worked with, documentation, just making sure that you have documentation of everyone who had stayed at that non-congregate shelter, and you're able to retrieve that documentation, as it is critical for being able to seek reimbursement.
Okay.
And I can just say, as long as it sure will help, just in terms of reminding you of that general requirement that it be something which is desired or directed by public health authorities.
Mike, this is Carolyn.
Yes. And
I want to remind you that we are at 10 o'clock, and I have a couple of closeout announcements to make.
perfect
First
segue.
of all,
Segue.
a giant thank you to Mike and the rest of the panelists. You can't get information like this anyplace else, and we at IAEM are very proud that we are the source of all things emergency management. One thing is that I'm going to suggest to Mike and the rest of the caucus that the remainder of the questions that were asked today, if they could be sorted through and perhaps create a frequently asked questions posting that could be on the caucus's website or associated with the webinar posting. Any additional questions that come up in the meantime can be sent to Chelsea. Her email was already announced in the meeting announcement, but it's chelsea@iaem.com. And lastly, that we have 2 more of these webinars. Obviously, they will be different by nature because the panelists may change, the questions will change. Those are coming up on Wednesday and Friday. So we encourage you, if you want to join us again or someone new wants to join us, please go through the registration process so that you'll be able to tag into our go-to webinar for later in the week. I want to thank all of the participants. We got up to almost 250 people at one point today, and this is just the beginning. Thank you all so much for your time and dedication to what you do. Take care and stay safe.
Thank you, everyone.
Thank you. Bye-bye.
Bye-bye.
Thank you.